Hello, and welcome to the Melanoma Research Foundation Ask the Expert series. My name is Kylie Lapira, and I'm pleased to join you this afternoon. The Melanoma Research Foundation is the largest independent organization dedicated to funding melanoma research and empowering and educating patients to advocate for melanoma funding and societal change. We are thrilled to present this month's Ask the Expert series throughout the month of May. This month's series is sponsored by DermTech, and we are grateful for their support of this critical educational program. Throughout the month, every Monday, we will be focused on a topic that will help educate and empower the melanoma community. Here at the MRF, we know that education is critical for patients making informed decisions about their care. That's why we are thrilled to provide this educational resource through our Ask the Expert series. The work of the MRF and our ability to provide educational resources, such as the Ask the Expert series, would not be possible without the support of our sponsors. That is why, again, I would like to thank DermTech for their sponsorship this month and to tell you a little bit about who they are. DermTech's mission is to transform dermatology with their non-invasive skin genomics platform, to democratize access to high-quality dermatology care and to improve the lives of millions. This afternoon, we are joined by Dr. Scott Drew, who will be speaking about skin cancer and melanoma. Dr. Drew received his medical degree from A.T. Still University, Kirksville College of Osteopathic Medicine in Kirksville, Missouri. He completed an internship at North Mundy Hospitals in St. Louis, a family practice residency at Rowan University of Osteopathic Medicine in Stratford, New Jersey, and a residency in dermatology at Deaconess Medical Center in St. Louis. Dr. Drew is a board certified dermatologist. As well, he has his board certification in family medicine. He is an author of several peer-reviewed articles in dermatology and lectures nationally and internationally on topics in dermatology. Dr. Drew is currently a dermatologist with the Dermatology Associates in Mid-Ohio. Before we begin today's presentation, please know that we encourage people to ask questions in our comments section. But please note that today's questions will be addressed individually following today's presentation. The MRF would like to remind our viewers that information presented today is for informational and educational purposes only. The MRF is not making a recommendation or endorsement of any drug, device, or treatment, or that any particular drug, device, or treatment is safe, appropriate, or effective for you. Questions regarding your care should be directed to your healthcare provider. We encourage everyone to visit melanoma.org to utilize our free resources like our Treatment Center Finder or Ask a Nurse, where you can get connected with a nurse and ask any questions you may have. Now I'm going to turn it over to Dr. Drew to share more about skin cancer and the melanoma diagnosis. Dr. Drew?
Well, thanks, Kylie. I appreciate that kind introduction. So as Kylie said, I'm Dr. Scott Drew, and I practice in Marion, Ohio. And one of the things we do here is manage skin cancer, both basal cell and squamous cell, as well as the much more serious cancer of malignant melanoma, which is a skin cancer of the skin, which can, left untreated, lead to metastasis or spread, and in some unfortunate cases can actually lead to death. But fortunately, over the course of the past several years, advances in diagnosis and therapy have led to an increased survival. In fact, over 90% of melanomas end up not being metastatic or not leading to death. In fact, when they're caught early and diagnosed early and treated early, they're quite survivable. So that is an advancement in science that we're really very, very excited about. So we put together a little slide presentation for you to help you understand a little bit more about melanoma, its myths, and some things that we can do to detect it and to prevent it. So as I mentioned, I'm Dr. Scott Drew. I've been practicing in Marion, Ohio for 30 years, and we have a very large skin cancer practice, both the management of, detection of, skin cancers. We diagnose them, we treat them, we use surgical tools and surgical techniques to remove them. And then in some cases, we actually use more advanced therapies if the disease is more serious. And as we look at the next slide, we'll see that we do a lot of research, and I consult with a company called DermTech, which helps us aid in the diagnosis of malignant melanoma. And it's really been a wonderful advance that helps people avoid surgical treatments if they don't need them. And so as the next slide goes on, the company is very, very dedicated to the prevention of skin cancer and its early detection. And they actually have a pledge which donates to the Melanoma Research Foundation to aid in its work in the education of patients and prospective patients in the diagnosis and management of skin cancer, particularly malignant melanoma. So let's look at some of the diagrams on the next slide that will help us understand in layman's terms the complicated and sometimes confusing world of melanoma. So one of the key diagnostic tools we use to make it simple is the ABCDEs of melanoma. And that can be sometimes confusing, but let's go through them so people can understand. The A stands for asymmetry. And that means that a mole, if you draw a line through the middle of it, one side should look like the other. In other words, it should be symmetric. If it's not symmetric, that's usually not a good thing. The B stands for border. The border should be regular, like a circle or an oval. It shouldn't be scalloped or undulating or in and out. It should be an even, smooth border. C stands for color. It should be one color: blue, brown, black, orange, red, not multicolored. And D stands for diameter. The number we use is 0.6 centimeters, but the common comparison is the size of a pencil eraser. And E stands for evolution or change. A mole should kind of stay the same. If it evolves or changes, that's another warning sign. So the more irregular, the more A, B, C, D, and E, that's a problem. So if a patient comes in and it's A, we also evaluate the B, C, D, and E. Or if it comes in and it's multicolored, we look at the asymmetry, the border, the evolution of the lesion. And those are tools that we use to help evaluate whether something should be further evaluated. So what can we do as patients to help prevent the development and expansion of skin cancer? Well, sunscreen's important. And there's a lot of misinformation on sunscreens. So yes, we need sun, and sun helps us get vitamin D, but we don't need too much skin. And what I tell patients is we all like a scoop of ice cream. We don't need a gallon at each setting. So the same with sun. A little bit of sun's okay, but the amount of sun you need, you can get very, very effectively without burning or tanning. So we like to ban the rays suns with UVA and UVB with a nice sunscreen. And I tell people the brand that they need is the kind that they like. They don't need to spend a lot of money, because if you find one that you don't like, if it's too goopy or too messy or too sticky, you're not going to use it. So I think a 30 is great for most people. If you're fairer, you need something a little bit higher, but you don't need 100 in most cases. Usually 30 to 50 is fine for the vast majority of people. And probably most importantly, over 90% of melanomas can be treated early very, very effectively. And if they're delayed, then it becomes much more serious. And again, some common sense things. Babies don't have the innate immunity to fight off the sun. So neonates and newborns shouldn't be in the sun, period. Avoid direct exposure, avoid the sun from 10 to 2. And if you're going to be outside, wear the right clothing. Everyone knows me when I'm on the beach. I've got a hat on, got a long sleeve tee, I've got thick white sunscreen on my hands and feet, because who's going to take care of my skin cancer, right? So you got to be judicious about covering yourself so that you don't get overexposed. And you need to re-expose often. I mean, I usually recommend a 50 because it just extends the amount of time for protection. And if you're going to be outside, you need to re-protect every 2 hours. And there's really no such thing as a waterproof sunscreen. If you're going to be outside and you're in the water, you need to reapply when you get out, because you'll get washed off. And so I have these signs in my office for people to understand and look at. And as we look at the next slide, we like to make them somewhat more user-friendly and not so just black and white and difficult to read. So this sort of recapitulates what I've talked about earlier. I think 15 is way too low. I like a 30 or a 50. But if you're going to be outside, you need to reapply every few hours. I recommend sunscreen and the appropriate covering. Again, I go to the beach and I see babies outside in 3 months old. That's really a danger to them, because if we think about probably 80 to 85% of our lifetime sun exposure happens before we're 18. I mean, think of who of us that's in the work world has time to go to the beach every day. So it's the kids who are outside running in the summer and going to the beach for the summer who have more time to be out in the sun. So as we mature, our lifetime sun exposure becomes limited. And of course, tanning is a no-no. There's a myth. Oh, I should go to the tanning bed and get a base tan before I go outside. There's no such thing as a base tan or a safe tan. If you're going to go to the beach, wear your sunscreen, stay out of the tanning bed. I have patients literally every day who say to me, "It's okay if I tan?" I say, "No." "Well, how about if I just tan once a week? How about if I just tan every day?" So tanning is really what leads to skin cancer, and you want to avoid that. And so I think it's important that we have these sort of aids around us. As we see in the next slide, these aids help us prevent these sorts of things. So when we look at this lesion, we talked about A, B, C, and D, and E. It's tough to evaluate E in a static picture like this, but we can see that up top around the noon, at the noon look of this picture, how the border's not regular, how it's many, many colors. You see black at 9 o'clock. You see gold and yellow in the middle. You see red on the side. This is clearly multicolored. The border is irregular. If you draw a line through it, the right side is more bulbous than the left side. This is a very, very classic unusual lesion. But if you look at some of the other spots around it, those are pretty normal looking. So that gives you a nice contrast. And again, this is a big lesion. I don't think many people would say this looks okay. But what we're concerned about really is the subtle lesions, the early lesions. We want to prevent skin cancer from spreading to things like the liver, the brain, the lungs, and melanoma is one of the few skin cancers that actually, or one of the few cancers that spreads to the heart. So we want to be attentive to get this taken care of early. So as we look at the next slide, this is a tool that we use in our office very regularly. In fact, every day. It's called a derm light. And it's a dermatoscope, and it is a refractive light through this lens that essentially is a high-tech space-age microscope that allows me to push a button on the right side there, pressed against the skin, and look for characteristics of the skin lesion through this focal lens that shows characteristics that are more unusual and more sophisticated than the simple A, B, C, D, E's we discussed earlier. And I think most dermatologists will have this handy to look at your moles or pigmented lesions, lesions of color, to help them determine if more work needs to be done. And sometimes that work requires a biopsy, which is a needle, and then a cutting instrument, either a punch biopsy or a scalpel, or a blade or scissors to remove the lesion, which is then sent to the pathologist. And sometimes we have other techniques as well. And so I know that one of the biggest frustrations and confusions is what is going to the dermatologist like? Because many people have never been to a dermatologist. And there's some areas of the country that don't have a dermatologist. And there's some areas of the world, like in all of Africa, there are like 14 dermatologists in a continent of 200 million people. So when you go to the dermatologist, there are some people there for psoriasis and acne and eczema and cosmetic things. And so sometimes it's off-putting not knowing what to expect. So when you go to the dermatologist's office for a skin cancer prevention check, a couple of things can happen. You'll meet the nurse first, who will interview you and ask you some questions and fill out some forms, obviously. And then they may offer you a gown, or they may, on your first visit, be a little more subtle and ask you if you want to lift up clothing and move it around a bit. At some point, the first, second, or third visit, they're probably going to ask for what's called a full skin exam. And that can be very off-putting. And so there are ways we try to make that less uncomfortable. But the dermatologist will look at your scalp, in your ears, look under your neck, on your chest, your back, below your breasts, in between your fingers and toes. They'll look at the legs. They'll look at the breast area, the abdomen, and the pelvis. And so it's very, very common to have that done. And of course, you can have a spouse or a guest or a parent or a child with you. You can have an escort with you. Very, very, very commonly, the dermatologist will have a nurse escort with you as well. And I think it's very common to have some concerns about that, but it's very, very important. And it's far less invasive than many other physician visits. Next slide, please. We'll see that sometimes melanoma can be quite subtle. So you see here on this toe, this patient was concerned that they had jammed their toe against something. But if you look at that, that doesn't look like a jammed toe. And it's got this band of color that is going from the base of the nail moving outward. That's called a Hutchinson sign. And that is one of this subungual melanoma, as we call it, is one of the 4 types of melanoma. And again, when caught early, it's very, very curable. Yet many people just don't think about marks on their toes. They write them off to trauma, and it's can be left to be diagnosed later in the game. And also people think that only very fair-skinned people can get skin cancer. And while that is true, people who have light eyes and blonde hair, what we call Fitzpatrick 1, the Norwegian Irish complexion, are much more common to get skin cancer. But remember, Bob Marley, skin type 6, very, very dark skin, died of malignant melanoma, skin cancer. So it's important that all people use sunscreen, all people get evaluated to prevent this disease, because this disease is, if you include basal cell and melanoma and squamous cell, it's the most common cancer on earth. If you add up all the cancers, breast cancer, prostate cancer, lung cancer, colon cancer, add them all up, that still is less than all the skin cancers combined. And sadly, melanoma can kill people in their youth. We have people die in their teens of this. That's not the most common, but we certainly people die at young ages from melanoma. So as we look at the next slide, we see a gentleman that's a very typical case, and we see all sorts of sun damage on his forearms. And of particular concern are those 4 unusual brown spots on his right hand. He's got a couple of brown spots on his left hand. So melanomas aren't always brown or red. They can be flesh colored. They have many, many different appearances. That's why they're so difficult sometimes to treat and to diagnose. And they evolve, they change. So that is an important component of this, the changing aspect of the lesion. So as we see in the next slide, what we have is a patient who's this is a very common situation. Patients often can't see their own back. And as we mature, we become less limber, in fact. So you see this lesion on this very pleasant woman's right shoulder blade, the scapula. You see the lesion is clearly asymmetric. Its borders are very irregular. That border at 3 o'clock is very scalloped. The diameter, it's big. The color is multicolored. And by her history, it has evolved. So this lesion has all the characteristics of a very, very bad lesion. So what are we going to do about that? Are we going to cut that off? Are we going to shave it off? Are we going to excise it? We have to make a decision what to do. And as we see in the slide that is next, we'll see that we have a new technology called DermTech. It's a smart sticker, and it's a textile. And what it's done is we apply this textile to an unusual lesion, and then we send that to the lab, and the lab is able to extract the DNA painlessly from the back of this textile, this smart sticker, and it runs the DNA, and it is a non-surgical biopsy. In other words, no scalpel, no anesthetic, no needle, no stitches, no downtime, and it has great specificity and great sensitivity that allows us in the dermatologic diagnostic world to have confidence that it has not greater than 99% confidence that this lesion should be or should not need to be biopsied. And that gives my patients great relief, because one of the fears is, oh my gosh, if I go to the dermatologist, am I going to have to be cut on? And now, certainly, if this comes back as a positive test, then it has to be excised. However, this eliminates the need for unnecessary biopsies when the DNA from this test comes back in a negative fashion. So it's helped me help patients not have to have unnecessary biopsies, and it gains confidence for me and my patients when I know the test is negative, and when it is positive, then we proceed to surgical outcomes. So that's a very new important tool called DermTech, and the smart sticker is very straightforward and painless, and it is a great advancement in the diagnosis of melanoma. And that helps us diagnose these lesions earlier. And if we diagnose them earlier, the treatment is always better. And what's really great about this is it allays fears. It helps people come to the office with more confidence and less concern. And it really has added a layer of comfort to an otherwise stressful situation. And so I would encourage you to learn more about that. And we're big fans of it here, at the Dermatoscope of Mid-Ohio in Marion. And as we look at this next slide, I just want to reiterate how grateful I am to be working with the Melanoma Research Foundation, because melanoma is one of the biggest challenges we face in dermatology. And this, of course, May is Melanoma Awareness Month. So I want to thank the people of the Melanoma Research Foundation for helping us bring awareness to this disease state and helping my patients find their lesions early and quickly and get the right treatment, and raising the awareness of how to prevent skin cancer and treat it when it happens. So I wish everybody a great afternoon and a great May. And if you're going to watch this live or on demand, maybe a nice June, July, or August as well. So wear your sunscreen, have a great day, and get your skin checked by a dermatologist every year, and do your self-skin examination every month. So thanks everyone for watching, and hope you guys have a great afternoon. Bye-bye.
Thank you, Dr. Drew, for providing our community with a thorough overview of skin cancer and melanoma. To our viewers, this presentation, sponsored by DermTech, will be available to view later on the MRF's Facebook page, as well as our YouTube page. If you have any questions for Dr. Drew, again, we encourage you to leave them in the chat, and the MRF will share them with Dr. Drew, who will answer them individually. This now concludes our second Ask the Experts series, sponsored by DermTech. If you are looking for more resources, please visit the MRF's educational resource page on our website at melanoma.org. Our next Ask the Experts session will take place next Monday, May 17th at 3 p.m. Eastern, 12 p.m. Pacific, right here on our Facebook Live page. We will be discussing the importance of conducting a monthly self-skin check at home. Again, the MRF would like to thank our sponsor, DermTech, for sponsoring this month's series, and for Dr. Drew for his time and expertise. We'll see you again next Monday. Thank you.